Welcome to the Blending and Braiding Funds to Support Home Visiting How-To Guide to the Blending and Braiding Guide. My name is Maggie Dixon. I am the Policy Assistant and Home Visiting Coordination Initiative, or HVCI, Development Coordinator at Prevent Child Abuse New York. This training is intended to simplify some of the information in the guide and serve as a teaser, if you will, for the content found in the updated version of the guide. This Blending and Braiding of Funds guide updates the blending and braiding to support early childhood home visiting in New York, which was produced by the Sparks Policy Institute for the New York State Early Childhood Advisory Council in January 2014. This guide is also a companion to Blending and Braiding Funds to support early childhood education programs released in 2021, which focused on childcare and other early childhood education programs. This guide explores the use of federal, state, and private funding to establish, operate, and expand home visiting programs across New York State. The guide helps home visiting providers establish a braided and/or blended fiscal model and a financing strategy to sustain a home visiting program. And finally, supports the implementation of universally offered home visiting services at either the county, regional, or state level. So this Blending and Braiding Guide is a component of the New York State Birth through 5 grant, which was awarded by the federal government. It's part of the Preschool Development Birth through 5 grant. We've included the grant language here for further information. Special thanks to all of our partners that contributed to this guide. The Blending and Braiding Guide and the Home Visiting Coordination Initiative, or HVCI, are housed at Prevent Child Abuse New York. Thank you to the New York State Council on Children and Families, the New York State Office of Children and Family Services, the New York State Department of Health, and other state agency partners for reviewing and collaborating with us on the development of the guide. Also, thank you to case study participants and the colleagues that we had review the guide, everyone in the early childhood space for being a part of the content. There are 5 objectives for this guide as well as for this supplemental video training, including learning the difference between blending and braiding, identifying applications and learning to identify the difference between when blending or braiding is more appropriate with a funding source, to feel more equipped to design a financing model, applying fiscal concepts to establish, operate, and/or expand a home visiting program, and finally, to think creatively about how all of these measures support the implementation of universally offered home visiting, which is defined in the guide and used as a frame for thinking about and applying these concepts. This guide is intended to explore ways in which programs, communities, and regions can think creatively and comprehensively. Blending and braiding funding streams are fiscal models to consider when planning for systems coordination. I'm going to insert one other disclaimer in here. Please note that this guide is not a guide to planning and engaging partners, a guide to sustainability, or a guide on legal or regulatory advice on funding streams. To learn specifics about funding streams or fiscal regulations, please contact your funders, seek legal advice, or perform your own research. Now, with the disclaimers out of the way, we can get into an overview of blending and braiding. So definitions and more in-depth information can be found in the guide itself, but I'm going to walk through some key points now. What is blending? So an organization typically employs a fiscal manager or a financial point person to use funding sources to pay for different expenses. Some funding sources cannot be commingled or combined, while other funding sources are more flexible. For example, many community-based organizations draw down state or federal dollars earmarked for prevention or family support, or community-based prevention and family support. This could take the form of the General Public Health Work Fund, for example. This fund flows through the Department of Health and local county health departments. This funding stream supports local health departments and encourages use of evidence-based practices to improve public health safety. Organizations may also receive investment from foundations, private dollars, or money from philanthropic donors. This is typically done through a request for application, or RFA, or a request for proposal, or RFP process, and varies depending upon the goals and the interests of the funder. So this pot of money from private or philanthropic dollars may be leveraged directly to fund a program and pay for direct service. These would be costs that the General Public Health Work Fund does not cover. We go into greater detail in the guide, but the bottom line is that many state or federal funding streams cannot be combined under any circumstances. However, in this example that I just laid out, a federal funding stream might be commingled with other private or philanthropic money, all depending upon the requirements of your funders. The blending financing model, some advantages. It's less challenging to implement than a braided funding model because reporting involves collective use of funds. So the reporting workload is significantly less. Fiscal managers aren't spending time reporting which funding source paid for an exact expense, which can require more capacity in the form of required staff time or training for said staff, and the knowledge of funding sources that these staff often need to possess. The capacity required can get complicated quickly, especially if an organization is running multiple programs and paying for staff time and work on various projects covered by different grants. Some considerations of blending include close work required with funders to meet reporting requirements. So as an organization, you'll need to consider the time you need to devote to develop a trusted relationship with funders. The flexibility of blended funding may appear risky for funders, as it often looks as though funds are being supplanted or replaced. A consideration is also the required care and understanding of allowable expenses under grants and funding streams. That is, blended funding can allow you to pay for services that may not be allowable under more categorical funding approaches. This can appear risky to funders, so it requires an understanding on their part that there will be less detailed information about how dollars have been spent or will be spent. Moving on to the definition of braiding. As we discussed in the blending section, the fiscal manager or financial point person uses funding sources to pay for different expenses. Some funding sources cannot be blended, while other funding sources are more flexible. For example, two federal funding sources, Community-Based Child Abuse Prevention, or CBCAP, and Maternal Infant Early Childhood Home Visiting, or MICV, cannot be blended with other federal funds. Many federal funding mechanisms have specific requirements for uses of funds. For example, MICV funds are mostly dedicated to direct services. CAPTA, or the Child Abuse Prevention and Treatment Act, have defined populations and purposes, and varies by state for use for cross-systems purposes. Allowable expenses under CAPTA and under CAPTA CBCAP, which is Community-Based Child Abuse Prevention, are programs that prevent and respond to child abuse and neglect. This may include home visiting through family resource centers, parenting support groups, and programs in the child welfare space. If a community-based organization can demonstrate how funding of a program can prevent child abuse or neglect in a community, it may be an allowable expense under CBCAP. It should be noted that evidence-based programs are strongly encouraged, however. The MICV funding stream is a program designed to improve outcomes for at-risk children and families through evidence-based home visiting programs. This requirement differs from that of CBCAP. Since both of these funding streams are federally funded, they cannot be blended, though they are very similar in the work and nature of programs supported by the grant. Thus, they can be each leveraged in different ways to support a program. The fiscal officer would just have to account for which operations were paid for using each grant, a braided model. Now we're going to get into some advantages and considerations of braiding. For the advantage side, since you're paying close attention to allowable expenses under each grant, this holds the fiscal officer and the organization accountable and can lead to better record keeping. Records and information on the back end is therefore probably more organized and efficient. Some considerations. While this structure is certainly advantageous, one must also consider the care that must be taken and time to report and track in the system. The fiscal officer, which the guide refers to as the back door, bills the appropriate funding source. It's the responsibility to ensure everything that happens at the front door, intake in this circumstance, if we're using home visiting as an example, lines up with the organizational capacity and funding. So in essence, we're ensuring that when we have a family come in and we're determining eligibility, there is the correct funding and layout on the back end internally to line up with everything that's happening on the front end. So crucial questions to ask are, what population are you serving? What are the services and case management provided? What's our program capacity? What's the length of services provided, etc. This information is detailed in Appendix D, Stage 2 of the guide. Stages will be explained a little bit later in this training. While all of the questions I just laid out might not have answers, it's a good framework to inspire thinking about what your program looks like and the questions that might be faced when community members begin coming to your program. Knowledge about the funding source acquired from each funder can help the fiscal officer learn how to spend down the funds in the most appropriate way and leverage based on the best interests of the organization, community, and the families served. We're going to get into a brief exercise to explore all of the information we just covered. You can walk through this example step by step in the guide, but this exercise takes a look at how $100,000 would be used across 3 funding streams to support a program. So, for example, there are 100 families eligible for, and the program has $100,000 to spend. If you have multiple funding sources covering all the families in your program, it is critical to assess the eligibility of families served by each funding source. It's also important to keep in mind that families who are eligible for 2 funding sources will not be served twice by the same program. So in this circumstance, 10 families are eligible under both funding streams A and B. However, not all fall under or are paid for by this same funding stream. So perhaps there's eligibility, there's room for a different funding stream to pay for each family, but that doesn't necessarily mean the fiscal officer is going to leverage said funding stream for the family because they can't be commingled or combined. So it comes down to really strict record keeping to keep track of how many hours or what requirements by each grant, where the money went in each circumstance. Front door program staff determine which program will best meet the needs of the family, and backdoor staff bill the appropriate funding sources. It's the fiscal officer's responsibility to choose the applicable funding source that will pay for the time and resources related to the program. It should be noted that the fiscal officer should start with the more restrictive funding sources and allocate on eligibility until funds are expended. The most important thing to remember with a braided fiscal model is that each of your funding sources will retain its original requirements and expectations, including all of the tracking and reporting requirements. You must manage your funds as if they are independent, even if you're using them collectively to support a program. Blending and braiding funding streams are fiscal models to consider when planning for systems coordination. That is, how does longevity of your organization contribute to the other family and child support systems in the community? Are there opportunities to partner for funding? Each program doesn't live in a vacuum. Ideally, each early childhood support has a role to play in a mother's, father's, child's, and family's life. If we can attain a system in which programs are aware of and understand the breadth of services in a community, there is tremendous opportunity for referral and holistic support for families. Let's take a look at the landscape of funding mechanisms. Table 1, Funding Streams Critical for Home Visiting, found on pages 17 through 22, is an update to the original chart, Funding Streams Critical for Home Visiting, from the 2017 Sparks Policy Institute Guide. The chart serves as a Spark Notes, if you will, to get the lay of the land for existing funding mechanisms that support home visiting, federal, state, and private. It is by no means an exhaustive list, but highlights some key players. Important information to understand is the responsible state agency that oversees the funds. With an understanding about how funds flow from the federal level through New York State, and then how they're allocated to various community projects within the domain of the funding will help executive directors, administrators, and financial officers be better equipped to track down the appropriate websites to consult for RFPs and RFAs, technical assistance, etc. As just explained on the previous slide, it is helpful to explore how funding is currently being used to support home visiting, either through direct service, which would be home visits and augmenting home visits, or through cross-systems activities, such as data and training and centralized intake. We can also use these tables to understand how federal funds are braided and combined with matching funds, state general revenues, and other funds, such as the Children's Trust Fund. This guide, though does not posit recommendations, highlights opportunities for growth both within Figure 1 and throughout the booklet. For example, how might the New York State General Public Health work dollars in local health departments be used to support maternal, infant, and community health collaboratives, or MICHs, on the continuum of early childhood and maternal health care? MICHs are funded by a combination of State General Fund, a dedicated line item in the New York State Executive Budget, Title V, and Medicaid. How might additional funding, such as to support community health workers in their work with improving maternal-child health outcomes in the community, be envisioned? So all funding streams on this slide aren't all dedicated to solely funding home visiting, but they contribute in some way, or could contribute in some way. This guide encourages thought about how the requirements of each funding pot might be applied directly to services, or to augmenting programs, or to other activities that complement home visiting and serve children and families, such as data, training, etc. Now, we'll get into the stages of how one develops a fiscal model. We can break down the process of how to blend and braid into stages 1 through 6. Pages 21 through 25 in the guide provide a high-level overview of the stages taken together. A detailed breakdown of each stage is in Appendix D. For Stage 1, identifying your vision and partners sounds straightforward, though may take some time. Decide what you're trying to accomplish on behalf of children and families in the community. Think about home visiting programs and services on a continuum. Different programs and models serve families with different eligibility, needs, and backgrounds. It's easy to fall into the trap of trying to match funding rather than needs and goals of a community. In this stage, you're encouraged to examine which partners should be at the table and how do they inform the vision. What are the best ways to engage families from the get-go? And how do we lay the foundation for collaborations with funders? Stage 2. Now that you've solidified your vision and have an understanding of it in the context of your community, and have laid the groundwork about who to engage to accomplish the vision, you can begin to develop your fiscal model. It is at this point that you'll begin to identify funding, which is where the crucial lessons about the difference between blending and braiding comes in handy. When answering questions about population served and what does the front door look like, you will think about the component parts of the program, so which population you're serving, what are the services, who delivers the services, etc. This will determine the layout and organization of your operations. Explore your financing options. Stages 1 and 2 have provided a clear overview of what should be funded. Stage 3 will help identify which funding sources to consider. Some of the funding sources you will have access to already, while others may be external. This stage facilitates the opportunity to explore current grant applications and private funding opportunities. Are there internal funding sources already available to your program? What funding sources do you currently use to support your program? And then what non-public funding sources could serve as a match? If you already have funding sources in mind, begin with those, but you should consider the information collected and identified in stages 2 and 3. Template A, Analyzing Your Funding Sources, is designed to allow you to make an analysis tool that can help you review existing and potential funding sources and will help you compare each funding source relative to the design of your program. This template helps analyze all of the information you collect. It's helpful to look at the funding stream overview, so the entity overseeing the funds, the intent of the funding stream, and reporting requirements, as well as eligible populations under the funding stream, so priority populations, income status, or geographic location. It's also helpful to consider staff qualifications, encouraged services, and infrastructure expenses, so encouraged, allowable, and disallowable under the funding stream. For home visiting, various programs have different program models, eligibility, and operations that can play a slightly different role in your community. Here we've included a screenshot of template A, which can be found in the guide, and you can walk through step by step to compare and take a look at funding streams. Stage 4. After completing your analysis of each of your potential funding sources, the next step is to explore the allowable and non-allowable costs for each funding source or gap. To identify the gaps in your funding source, use template B, analyzing your gaps. You'll need to populate the template with details about your population and their service needs. Analyzing your gaps takes a look at what you currently have funding for, and if you don't have funding, where might you find that funding source, and how can you allocate it for each program? By taking the information entered in template A, analyzing your funding sources, and translating it into template B, analyzing your gaps, you can identify the populations and services that can be supported by funding sources. You may realize that you cannot fund some expenses from any of the identified funding sources. If the expenses are not on your list of priorities, this is the time to decide which services you cannot support, or to find additional funds to close the gap. Either way, this must be settled by the agency and be a part of the front door decision-making process. Thus, when a family comes to the program or asks about enrollment during the front door process, a decision can be made. Stage 5. Develop your coordinated financing plan. A coordinated financing plan, or template C, as referred to in the guide, is your overall approach to understand the design of your blended or braided fiscal model. This is the stage where all of the pieces fit together. So your program budget, cost allocation, your front door and back door protocols, so how staff make decisions to serve your families, tracking and reporting, financial requirements, contracting, and training. We've included a couple key questions for you to think about your program and define some of these questions, which will help you overall create answers to these systems. This is a sample of, as we've been referring throughout this training, what the front door staff who are seeing families, making determinations on eligibility and performing that intake in the case of home visiting, versus backdoor decision points, which would be your internal, your fiscal staff, financial decisions, making decisions about what the program capacity is. So we've included a chart to compare and take a look at the difference between each decision point. This is a key point throughout the guide when talking about blended and braided fiscal models and program financing models generally. If the front door is well designed, so intake and knowing capacity, the back door will never run into a situation where a service has been provided that has no funding source and cannot be paid for. This is the final stage, stage 6, where you implement your model. You track outcomes, opposed to outputs, and improve. Collect feedback from staff, families, and other stakeholders. Was the process seamless and transparent to families? Do front door staff have the level of decision-making they need to expedite access to services, make referrals, and answer questions? Do backdoor staff have enough information from program staff to make good decisions regarding allocation of funds? Finally, do your funders feel confident that you're spending their money appropriately and achieving good outcomes? Plan to revisit your coordinated financing plan at least yearly and as new funding sources change. Make sure someone is responsible for taking new information from funders and incorporating it into the plan. Now we're going to discuss some applications as it relates to home visiting. The Home Visiting Coordination Initiative was established in 2019, and the HVCI serves as a forum for communication and coordination. The aim of the initiative is to increase access to and collaboration within and between home visiting and the early childhood sectors. In 2019, the HVCI conducted a needs assessment of the home visiting sector by convening 10 summits, which were facilitated discussions in each of the New York State Regional Economic Development Council regions. The HVCI subcontracted with 10 stakeholders identified as backbone organizations to lead the effort. The BBOs serve as community conveners with varied experience in direct service and public policy. And it should be noted that BBO stands for Backbone Organization. So for example, the Region 3 BBO convener is a Maternal Infant Community Health Collaborative, or MITCH, in the southern tier. And Region 7, which is the capital region, Red Sea, is a Child Care Resource and Referral Agency. A Strengths, Weaknesses, Opportunities, and Threats Analysis, or SWOT, was conducted in each region to inform the needs assessment process and identify priority areas. Input was given in each region, incorporated from county stakeholders, parent representatives, home visiting programs, and other early childhood professionals. These conversations were analyzed to identify trends across regions. Prevent Child Abuse New York released the final report in 2020 with 3 recommendations: increase home visitor workforce development and support, conduct a public education campaign, and advance a coordinated system for intake and referrals. These priorities coalesce into one overarching recommendation: universally offered home visiting for every family across New York State. Universally offered is defined as voluntary services paid for by insurance and extended to every family with a newborn. This vision aims to support child development and strengthen families by connecting them. For more information, see the Home Visiting Coordination Initiative final report in Appendix B of this guide. It outlines themes that emerged during the 2019 HVCI summits. Themes demonstrate the need for funding, community resources, and data. 2 statewide summits were held during the Preschool Development Birth through 5 grant years 2020 and 2021. The summits facilitated conversations about the value of home visiting, the need for increased financial support, and the potential for increased state investment. The findings of the HVCI overall emphasize the need to explore financing options for home visiting, which are laid out in this Blending and Braiding guide. Here's the definition the guide uses for universal home visiting, which prompts us to think about our vision of service delivery for families in New York State. This guide, again, does not posit recommendations, but rather encourages us to think creatively about not only the ins and outs and logistics of our program, but the overall goals and vision. Please find contact information here, and special thanks again to our partners at the New York State Council on Children and Families and to the Preschool Development Birth through 5 grant. The Home Visiting Coordination Initiative website, www.nyshomevisitcoord.com, is on the slide as well, which is where a copy of the guide can be found. In addition to the Blending and Braiding guide, please consult the website for recorded webinars on a variety of topics. Finally, I would just like to note that we partnered with our partners at the Center for Human Services Research at SUNY Albany to collect data on all activities funded by the Preschool Development Birth through 5 grant. So on your screen, you will see a screen grab of a QR code, as well as a link in the description box of this video to provide feedback and give us information about how you will use this training in your professional life. Please consider providing feedback and information to us, as it not only fulfills the requirements of the grant, but also helps us tailor future information, future trainings, future webinars to the needs of our audience and provide pertinent information. So we would greatly appreciate that. Again, please feel free to reach out to me with any questions, and thank you for viewing this training today.